we are lucky on Cape Cod. We have this group of us. It's up to us to move this message forward. Shall we hear another one? Thank you so much for coming. Because it takes us to work together to support this prevention network. So, and there's some pretty amazing additional facts, and these were provided for me from Jody, and that is by 2020, mental health and substance abuse disorders will surpass all physical diseases as a major cause of disability worldwide. Each year, approximately 5,000 youth under the age of 21 die as a result of underage drinking. Annually, tobacco use results in more deaths, 443,000 per year, more than AIDS, more than unintentional injuries, more than suicide, homicide, and alcohol and drug abuse combined. And almost half of these deaths occur among people with mental health and substance abuse disorders. And that comes from partners like SAMHSA and CADCA, because we have not only do we have local partners and state partners, we have federal partners in this process that can help us as a community prevent substance abuse among our youth. And that's really what that's about today. We've provided for you fact sheets downstairs as well, so please take advantage of those. And if you'd like to buy Kevin's book, they are available. So now I open it up for questions. If you want to just kind of like maybe raise your hand, I can like honor you, and then Patrick could address it. Does that sound right? Does that sound good? Go ahead. And we welcome all voices.
My name is Mickey Martin. I'm the author of a book called Medical Marijuana 101, and I strongly agree with a lot of what you said. I think you've used a lot of fear and fear-mongering to make your points based on OxyContin, based on tobacco, based on alcohol, but you don't have any real facts on people being harmed by marijuana. And the reason that you present all those other facts in such a scary way is because the evidence isn't there. It doesn't support your cause. So I have a question for you. How do you support continuing prohibition when it's resulted in us locking up 25% of the world's prison population while we only have 5% of the actual population, and most of those being minority and poor people who we are targeting and attacking and who are losing their family, and it's become the scourge? I mean, this is the results. It's nice that you say drug courts and all that, but that's just not reasonable. Even you said if you don't pass your drug test at the drug court, where do they send you? Back to jail. So we're still talking about incarcerating people. We're still talking about prohibiting something that's far safer than alcohol, far safer than OxyContin, far safer than tobacco, far safer than any of the scary things that you put out there, and the evidence doesn't back it up. So how do you continue this crusade without having respect for the attack that it does have on poor people and minority communities in our society?
Thank you for your question. I appreciate it.
And I brought you some books, too, you and Kev.
Okay, good. So, like you said, we're early on the consequences because...
Marijuana's been around for 5,000 years. How are we early on anything?
Well,
it's everywhere.
Okay, let me answer your question. We do know the hard science, as I pointed out. NIDA has a longitudinal study on teenagers started back in the 70s. We know those facts and figures.
But the reason teenagers have more access is because there's no regulations. There's nobody. The guy at the gas station selling weed's not carding anybody.
So, but here's my point. My point would be that we'd love to have you help us track those potential, in your view, potential harmful impacts. Because you're absolutely right. If we had more of that evidence, right, that you say that we don't have, I think it would be compelling to the broader public. So will you support us monitoring the number of hospitalizations due to marijuana?
They already do. ONDCP's been working on those facts for 40 years and have come up with nothing. Your own National Institute for Drug Control policies don't work.
Have a problem?
No, absolutely.
Okay.
And then you can also add in the reduction of alcohol if cannabis was legalized, and how many people aren't using a more dangerous subject because they feel more comfortable using a safer substance like cannabis. Are you going to put those facts in there too?
So with our kids, would you help us track maybe, if so or not, maybe the increased truancy or dropout rates after marijuana is essentially legalized in these states? Would you?
Sure, absolutely. I mean, if you look at the facts, more kids right now say that they can get marijuana than alcohol. So if it's in a legalized...
So those are two
situation.
That's responsible. Now,
Nobody wants kids to get alcohol, or to alcohol or marijuana or anything. But the fact is they do, and when they do, I don't want them to end up in prison.
neither do I.
But they do.
Well,
Black kids are in prison at an alarming rate for cannabis.
so let me ask you a rhetorical question. If you're for ending prohibition, where do you stop? Do you legalize heroin and cocaine and all of the other drugs?
I think if you look at Portugal, who's done that, they've had an amazing success rate at finding it, and like you said, finding it in more of a healthcare issue where they can actually access heroin and other drugs in a safe environment where if they want to access their drugs, they also have to take on a period of counseling to access them. So it's actually worked phenomenally in the country that we've seen it happen.
Well, they're actually reversing their policies now due to their own experience, but I hear what you're saying. Now, in terms of minorities affected, now, would you, because
addiction rates
so
are down.
About minorities, would you have a major criminal penalty for companies that overtly target minorities in their marketing, such that they would lose their licenses to market their product if they were targeting minorities? Because you clearly do not like the notion that our minorities are disproportionate.
I think the way we treat corporate America is fines. We don't put anybody in corporate America in jail in this country.
But you would support.
Absolutely.
Okay, so that's good.
But then what targets children? Is a Snickers bar targeting children?
The liquor industry has multiple of liquor stores in poor and minority neighborhoods that far exceeds what they put in majority neighborhoods. That's just a fact. Tobacco also.